It's a real pleasure to be with you this evening. Dr. Allison, I'm sorry that you had to sit through the long list of Dr. Jensen's attributes toward me. You're the honoree here this evening and so much more deserving of those accolades than I will ever be. And I'm here in part to tell you how the efforts that are being made by the people in this room and other researchers, investigators across the country, in my view, is a noble calling. It is something that is so important for our nation and for the citizens of the world. And so I'm honored to be here and to offer just a few observations, but I want to pay so much tribute to those who, on a daily basis, with great frustration and significant uncertainty, decide to go to a laboratory every day in search of a cure, a treatment for a disease. I'm of the view of the things that Roy just said. In fact, I asked him what I might say this evening, and he gave me some suggestions, and then he utilized them in his introduction of me. I'm unaccustomed to being in an audience, because I'm a United States Senator, of such intellect in this room. But Roy demonstrated significant political skills in his introduction. Let me say just a couple of things, and that is that it is critical for our country to invest today, tomorrow, in the future, in a consistent, ongoing basis for biomedical research. That would not get any opposition in this room, I'm quite certain. But as a non-scientist, let me tell you why I think that's so important. You know, my interest in politics is really based a lot on trying to improve the lives of Americans. And if you are a person who cares about our fellow citizens, you want the necessary research dollars available to the brightest minds, the most active investigators to try to find cures and treatments to diseases. And cancer comes to the forefront so many times. It affects so many people in our nation. You want that because you care about other human beings. In my view, if you are the most caring, compassionate, use whatever word you'd like to describe elected officials or Americans, progressives, liberal, if you fit that mold of care and compassion, although I, as a Republican, pretty conservative individual, believe that moniker fits us as well. But if you're one of those people who just care about people, you should be for medical research. If you are the most conservative, the person who cares about greatest level of efficiency, if you have a great desire to see that no dime is spent of taxpayer money that is not worthy of being spent, you should be for biomedical research. Because this brings us all together. We can save significant amounts of money in our medical expenditures now and in the future. Long before President Obama was president, I had the Moran 10-point plan. I don't imagine that it competes with the words that you've heard, Obamacare. You've heard those. Anybody ever heard of the Moran 10-point plan? Well, I had one long before President Obama was proposing changes to our healthcare delivery system. And one of the significant, toward the top of the list, points in that 10-point plan was further investment in medical research, because it is one of the absolute best ways in which we can save medical dollars. Our country will bankrupt itself in the absence of finding cures and treatments to cancer and other diseases, and this is an investment that everyone should find appealing if you care about saving money. I actually think that, at least I've never met anybody in public service, in public life, in politics that didn't care about other people. And so all of us have experienced the desire to find that cure, that treatment for someone we know, someone in our family, someone down the street who has encountered the disease of cancer. And so if you care about people, this is a place to invest. I got concerned. I care a lot about the future of our country, and I think there's an economic and moral aspect to the way that we spend money here and the deficits that continue to grow. And this may sound like something contrary to the desire to invest in medical research. But if you care about the deficit, if you care about the fiscal condition of your nation, you ought to be interested in investing today in medical research, because it puts us on a path toward a greater opportunity to balance our budget. And incidentally, there's more to balancing a budget in the federal government than just the amount of money we spend and the amount of money that we take in. It's more than trying to determine what the tax rate should be. It's more than trying to determine what the spending levels should be. Now, that's the problem, is the gap. But you know, a way that we can approach this, a way we can reduce the gap between spending and revenues, is to have a growing economy. So there's actually this third reason that investment in biomedical research makes sense, and that is we can once again have a growing economy. Bad news today, you may have seen that the gross domestic product increased by 0.1% on an annualized basis this quarter. Very hard for Americans to see the opportunities that they would like to have in their lives in the absence of economic growth. Our ability to find the resources necessary to fund the things that we think are important, that are our priorities, is dependent upon economic growth. What that means is more people working, and therefore more people paying taxes that contribute to the opportunities we have to further invest then into the things that matter to us. And so biomedical research is a place in which we can grow our economy, and the innovations, the technology, the latest developments create opportunities, again, for additional growth. One of my goals as a member of the United States Senate before Kansans tire of my service is to make certain that we have the opportunities for that growth to occur in our state, and that jobs are created in the areas of research and science and technology, engineering, medicine. And that takes me to the point that I want to make certain that every young person who has the desire to be a scientist, I indicated when I was at the University of Kansas, and I'm a graduate of the University of Kansas, when I went there, my goal was to be a geologist. Unfortunately, I took physics. And so I know there's no one in this room that can sympathize with the circumstance I found myself in now a long time ago, but I got lost on quasars, and somehow I became an elected official instead of a scientist. But there are many with more tenacity than what I had. And we want to make certain that those who have the desire, the intellect, the ability, the drive to be scientists, to be researchers, to cure cancer, to find its treatment, we want to make certain that every young American who has that dream for their lives has the opportunity to do so. We want to reward individuals who've decided to pursue that kind of career. And I know that in the absence of increasing, stable funding for NIH and other scientific efforts, the ability to become disillusioned, not because you're uncertain about learning about quasars, but because you're uncertain about whether or not the funding will be there for you to pursue your research, the longer it takes for that young scientist to have an award coming from the National Institute of Health to reward their goal of treatments and cures and research, the longer that gap occurs, the less likely we will have the scientific minds necessary to pursue the goals of our society. So one of my constant arguments with my colleagues and in the Appropriations Committee on the Senate floor is don't do anything that doesn't send the message to the next award winner, to the next Dr. Allison, that he or she has the opportunity to pursue a career as a scientist, a researcher, as a biomedical researcher. And so our goal and consistent effort will be additional funding for scientific research, that it's consistent, that it's not up and down. And I was pleased to be part of the effort in the House of Representatives to double the funding for NIH. But the sad fact is, the positive fact is we accomplished that. The sad fact is that once we did, we took our eye off the ball. Dr. Collins at NIH has a chart that's very compelling, and he shows the dramatic increase in funding for scientific research, medical research, and he shows that once the doubling is reached, then it begins to fall off. And then he has another chart that shows if we would only continued back in the very beginning to fund research at the rate of inflation, we'd be at a higher level today, another $10 billion more today than we are. And so while we may pursue the idea of doubling scientific research, I think probably what is more important is that increase that includes a cost of inflation, consistent, year after year after year. So we send a message to you, to your peers, and to those who will follow you that America is interested in your work and interested in the results that you may attain for the benefit of our country. I want America to be the country that is the bright, shining city on the hill that we've been described as. And what you and what future scientists do in this country will determine whether or not that's the case. The greatest opportunity we have for economic growth, for intellectual development, for cure and care of people, and for a government that lives within its means is biomedical research, funded by the taxpayers because the benefits they will accrue are worth the investment. It's an honor to be with you this evening, and I am pleased to be here and speak on behalf of many of my colleagues who share those views. For those of you who are cynics and believe that Washington, D.C. is broken, there's plenty of evidence that you can find on the nightly news. My suggestion is quit watching it. If you're unwilling to do that, let me suggest to you that there are many instances in which Republicans and Democrats, rural and urban, progressives, liberals, conservatives, moderates, whatever the labels are, can find common ground. And this is one that we have no choice but to find common ground. And fortunately, it's one that there should be no problem in doing so. And so each and every day, we will work to make certain that all members of Congress understand this importance. We appreciate the fact that you are here to help us accomplish that. And every day that universities and others are there with a message about its importance is a day in which we've made progress in bringing us all together on the noble goal of ending cancer through scientific research. God bless your work, and I wish you great success. It's an honor to be here, and I thank you for the opportunity.